customers have access to provides these benefits. Again, that's part of the ACA. And that covers things such as ambulatory patient services, emergency services, hospitalization, maternity and newborn care, mental health, substance abuse services, prescription drugs, rehab and habilitative services or devices, lab services, pediatric care, and pediatric oral and vision care. In terms of the everyday or the day-to-day immediate value, again, the value is primary care, right? Pediatric health and dental care, coverage for specialty services such as women's health, cardiologist, prescriptions, mental health care and substance abuse disorder services, and laboratory services. Again, part of the everyday. And again, it could be, it's taking a lot of this information and chunking it out into smaller bite-sized pieces of information. Again, you may already do this, but again, it's really helpful. It can be helpful for people to not be overwhelmed by health insurance. I don't know anything, and I think a lot of us saw this last year in the first year when a lot of information was out there and people were probably coming to you becoming a little bit overwhelmed with knowledge and information. So again, why is it important, the value of inpatient emergency and follow-up care? So as we were talking about inpatient care like surgery, emergency care, such as when there's illness, injury, or condition that's so serious that a reasonable person would seek care right away to avoid severe harm. Right? It's like a child gets hurt or someone gets hurt, they need emergency services. No prior approval is needed whether the provider or the hospital is in the plan or in the network or not. Again, we'll talk about network plans in a little bit. So just a little bit of note here that the average cost for a 3-day hospital stay is $30,000. Again, average cost. Average cost of fixing a broken leg is $7,500. So these are some figures that you can always add in when you're working with your clients about why it's important. Unless they can afford to pay that, they might want to reconsider or consider health insurance. In terms of the value for preventive and chronic care management, health insurance for preventive care prevents illness, detects illness at an early stage when treatment's likely to work best. The health care law makes many of these free. How many have had your flu shots already? Okay. Flu shots, screening mammograms, right? You go to the doctor or you go to the clinics at your pharmacy if they have them, and they just say, "Oh, do you need to get the flu shot?" All right. They help you to become well and stay well. All right. And again, it's extremely important.